reported deaths at over 171,000 people. And confirmed with COVID disease with 37,755 deaths. In Alabama this morning, we saw just over 5,000 case patients reported as having confirmed COVID-19 disease, 5,092, with 172 reported deaths and 144 died from illness. And in Mobile County this morning, the live dashboard was listing 686 Mobile residents with confirmed COVID-19, with 35 deaths and 28 of those died from illness. So today, our Chief Medical Officer, Dr. Laura Cepeda, had this comment: this week was predicted to be the surge or peak for COVID-19 in Alabama, and many people are asking, is it here? Unfortunately, a pandemic is much like the stock market in that our true peak can only be determined in retrospect. So thank you, Dr. Cepeda, for reminding us of that. Been talking a little bit about the change in reported classification for a COVID death, and I got this information from the Alabama Department of Public Health yesterday. The COVID-19 death count will include decedents with a positive COVID-19 laboratory test, as well as individuals whose death certificate lists the cause of death as COVID-19. So that is what we're using now for classifying a decedent as being COVID-19. The positive laboratory test for a decedent is a pretty quick thing to determine if they are tested when they are still living. So that should speed up the process with which we receive and classify and report COVID-19 deaths. The death certificates where COVID is listed as the cause of death could be delayed, and almost certainly will be delayed, and that will continue to cause a delay in some of the reported deaths that we have. So we are looking forward to moving toward reporting only one number. So in Mobile County, among the 690 cases that we have, again, 11 to 12% of those are hospitalized. And now that we are recording deaths a slightly different way and being able to record them faster, we're reporting 28 deaths due to COVID-19, and that raises our death rate to 4.1% of all confirmed cases. Our distributions of age and sex and race and zip code really haven't changed much. We see some fluctuations in zip code because we know we have outbreaks going on in a couple of congregate settings, long-term care facilities, and detention center. So those cases sometimes drive the number up disproportionately in those zip codes. So on Saturday, I reported that we only had 3 cases added to our case count, but on Sunday rather, that was 28, and yesterday we had 21 new cases reported to us. So it seems like there was a little bit of an anomaly over the weekend, just having 3 cases reported to us on Saturday, but maybe things got back to normal, because on Saturday we had 28 cases, and on Sunday 28 cases and 21 yesterday. I also want to mention that the Centers for Disease Control has begun requesting that we report confirmed and probable cases to them. So we will begin including the probable case count with our number of COVID disease. So the way this is different is a person who has symptoms of COVID disease, cough, shortness of breath, or fever, and they have a PCR laboratory positive test for COVID-19, they are classified as confirmed. If you are sick with COVID symptoms, fever, cough, shortness of breath, and you have exposure to a laboratory confirmed COVID patient, then you can be classified as a probable COVID case. So there's a little subtlety, but it allows for a classification of someone who is sick with COVID disease and has been around someone who's been laboratory confirmed with COVID, but has not had a laboratory test performed on themselves. So this is not unusual, not unlike what we do for some other diseases. So we'll be reporting combined the confirmed and probable number. The only other thing that I really want to talk with you about today is we're going to put some information on our Facebook site that's provided by CDC. They've updated or provided guidance on things that I get a lot of questions about. And so, for example, they've provided documents and resources since April 17th, so this has just been in the last few days, including how various professions can protect themselves and others and how their employers can help. So, for example, what mail and parcel drivers need to know about COVID-19, what food and grocery pickup and delivery drivers need to know about COVID-19, what rideshare, taxi, limo, and other passenger drivers for hire need to know about COVID-19, what airline catering kitchen workers need to know, what airport, retail, or food service workers need to know, what firefighters and EMS providers need to know, and then some other things that are useful considerations for state and local health departments for investigating and responding to COVID cases at homeless shelters, forecast for the United States, including a forecast of COVID-19 deaths in the U.S., advice for people caring for someone sick at home or some other non-healthcare setting, strategies to protect those who are most vulnerable in households living in close quarters, and then steps to stay safe that every American and community can now use to decrease the spread of coronavirus. So we will make those available to you and point you to those resources so that if you have need to know or frequently asked questions, you can go there and look for the information that's provided. Maybe just one other point to clarify today. When the state health officer released the stay-at-home order, and we told everyone to stay at home to the fullest extent possible and only go out if you needed crucial supplies like medicines or groceries or food or to care for a family member, we didn't talk much about how that applied to apartment buildings or complexes that have multiple units in the same building. And I get a lot of questions about these kinds of complexes where people think that they can still roam the halls or go to the common areas of these complexes. And in the context of this outbreak, if you live in an apartment complex, staying home means staying confined to your unit or your apartment, not going into congregate settings like the break room or the gym or the laundry room, and not implementing that 6-foot distance and wearing a face covering. So please, if you live in a senior citizen home, if you live in a apartment complex, please try not to violate that 6-foot distancing rule and cover your mouth with your face with a cloth when you're in those common spaces of the facility. So I just wanted to clarify that because I worry that we may have some mass gatherings of 10 people or more happening in apartment complexes when they shouldn't be doing that because they're putting themselves at risk of transmission. And once it gets in a building, it is very, very difficult to control or slow the spread in an apartment complex or in a building that has multiple units. So unless Luke has questions on Facebook, looks like we're done for today. Tomorrow, the live update will come from Government Plaza, and the 3 principals in the Unified Command will be speaking with you directly there. So we'll pick back up with Facebook Live from the Health Department on Thursday. Thank you.
Thanks for joining us here on Fox 10 News. I'm Chelsea Sayasan. Now, we just heard from Dr. Randy Murphy and the Mobile County Health Department. There is a new classification for COVID-19 deaths. So the descendant must have a positive laboratory test or the cause of death is COVID-19 on that death certificate. 11 to 12% of patients are now hospitalized in Mobile County. The death rate in Mobile is now at 4.1%. CDC now requests confirmed and probable cases. So confirmed means you have symptoms and a positive PCR test. Now you're classified as probable if you have symptoms and have had exposure to a positive patient. We are expecting to hear from Mobile Mayor Sandy Simpson at 3 p.m. today. Of course, you can find both of these press conferences on our Fox 10 YouTube channel and our Facebook page. I'm Chelsea Sayasan. We'll see you here in a bit.